this is a patient of posterior high transsphincteric fistula. We can appreciate that we can go from the down axial section, fat suppressed axial section. We can go up, we can go up. We can appreciate anal canal. We can appreciate anal canal. We can appreciate that there is hyperintensity at the posterior aspect, at the tip of the coccyx, some hyperintensity of the coccygeal tip bone also we can appreciate. This is hyperintensity. This is deep postanal space. This is the below the coccyx. This is the deep postanal space. We can go up below the anacoccygeal ligament deep. There is hyperintensity. There is complete hyperintensity below the coccygeal plane, and things are going up, and this one area we can see that it is opening at 6 o'clock. So this is from near about 5-10 section of upper mid or upper part of the anal canal. We can appreciate this area of the coccygeal tip and below the coccyx, it's an anus to coccyx connecting anacoccygeal ligament. This below than that, this is complete hyperintensity. This hyperintensity, this is a complete tract, this is complete tract, and this is complete tract. So opening is at 6 o'clock, deep postanal space, and tip of the coccyx and below the anacoccygeal ligament. This is kind of a posterior high transsphincteric fistula starting at a 6 o'clock position, going into the tip of the coccyx, and it is below the anacoccygeal ligament. This is a deep postanal space. It is connected. We can appreciate in the sagittal section. This is the anal canal. This is the bladder, and this is anal canal. This is the tip of the coccyx. It is going like this, sublevator in the deep postanal space and connecting here into the coccygeal tip. This is connecting here into the coccygeal tip. This is the hyperintensity. This is the hyperintensity getting connected. So this is a classical presentation of posterior high transsphincteric. One component which is going just below the posterior high transsphincteric, starting at internal opening 6 o'clock, going into a transsphincteric tract. This is a transsphincteric tract, deep postanal tract, intersphincteric region. This is just an internal opening, means it is a tract. Internal opening at 6 o'clock, intersphincteric tract, transsphincteric tract, going in deep postanal space, going paracoccygeal and reaching up to the tip of the coccyx, opening as opening at 6 o'clock, posterior high transsphincteric tract. So we may need to consider sphincter preserving procedure for this patient.